Good afternoon. This is Michael Jaff from Massachusetts General Hospital. I'm very pleased to have a chance to sit down and talk with Tim Ferris. Tim, great to have you here in Las Vegas.
Thank you very much, Mike.
Tim is the medical director of the Massachusetts General Physicians Organization and also vice president for population health at Partners Healthcare. So you have a couple of things to keep you busy in your day.
I stay busy.
Yeah. So Tim, first of all, just so everybody knows, you're a practicing internist.
I'm a practicing internist, yeah.
And what percentage of your time do you see patients?
Probably 10% of my time, yeah.
General internal medicine stuff?
Primary care, general internal medicine. Yeah.
And how long have you been at Mass General?
I've been at Mass General my whole career, so 15 years.
So you grew up where?
In Worcester, Massachusetts.
And went to undergraduate?
Middlebury College.
Oh, that's a great school in Vermont.
Yeah, good skiing.
Big language programs there
That's
too,
right.
Did you do any language studies
French.
there? Are you fluent in French?
My children who are fluent would say that I'm not fluent.
Okay.
But I can get by.
Got it. And then medical school where?
At Harvard Medical School.
So you really haven't left the state.
I did actually go to school for 2 years. I studied philosophy at Oxford. So I did branch out a little bit.
Got it.
Yeah.
And I guess there are a bunch of things that you and I talk about all the time at work that many people need to know about. So for example, what is this term population health management? What does that mean, and why should people listening to us today know about this?
Well, you know, like all terms, it's a term of art. It's currently in vogue. It's not really new, the concepts underlying it, but sometimes you need a new word to describe something that has been around for a while, and I would say population health management falls into that category. It really is about investing in the resources that are necessary to provide the coordination of care for patients that the fee-for-service system doesn't have a mechanism for investing in, and so have been, we've as a system underinvested in those aspects. And population health management is the term used by providers to say, okay, so if I'm at risk, you're probably going to ask me about this, about under an ACO contract, how do I deploy resources to get a return on that investment? And population health management is sort of the current, the vogue term for how we go about thinking about making those investments.
And is population health management focused on specific disorders that patients have, or is it a period of time that one manages a patient? How do you think about that?
So it's a good question, and the complicated answer, unfortunately, is that it's all of the above. So it's really about, if you break it down into a more simplified form, it's about taking longitudinal care of a set of patients, and it's also in maximizing the efficiency in that longitudinal care, and that's sort of a primary care focused approach. But really, in my mind, it can't be disaggregated from an episodic approach, and that's fundamentally about specialists and about building episodes of care and managing episodes of care more efficiently.
So Mass General's been around a long time, considered to be a pretty successful venture, and still widely regarded as one of the better hospitals in the nation. So what's the impetus for thinking about changing the way things are done at a hospital like ours?
It's a great question, and I'll tell you, I get that question quite a bit. And I think that the answer is that the leaders at Mass General, and so I don't think they would, I think they have sanctioned what I'm about to say. So this is Peter Slavin and David Torchiana and Gary Gottlieb at Partners Healthcare, and really it's about the fact that the healthcare cost inflation is unsustainable. Every town in the United States was laying off teachers several years back in order to pay for the health benefit obligations for the municipal retired workers. And that's unacceptable. We are mortgaging our future, I guess is a popular term. And so when healthcare costs are going up at twice the rate of inflation, that's unsustainable. We have to do something about that. And so Mass General started a strategic planning process a couple of years ago. And that process fully embraced the idea that in our clinical missions, which is only just part of an academic medical center's missions, we really need to focus on delivering better longitudinal care for the populations that we care for in primary care, and better episodic care for the tertiary referral care that we take that is a big part of what Mass General does.
So Partners Healthcare represents the parent organization of, explain to the group what that means.
Well, so Partners Healthcare is the corporate parent to Mass General Hospital, Brigham and Women's Hospital, and a number of community hospitals that are closely affiliated, a network of physicians in eastern Massachusetts, and very importantly, post-acute care, so rehab facilities, home nursing, and mental health, McLean Hospital. So it really is the attempt to put together a system. And that system, when that system contracts to take risk on a population, we actually can optimize care across the entire system. So it's sort of hard to, if with a provider of healthcare, if you're just a hospital or just a physician group or just a post-acute care provider, to optimize care for a patient, because fundamentally the other members of the other people in the healthcare journey aren't aligned with you, right? But if you have it under one system of care, then you can make internal trade-offs that benefit the patient, right? And I think that's where the sweet spot is in this new approach to accountable care organizations.
So not that long ago, there was a big announcement that Partners got into the medical insurance business.
That's right. So
what was that about?
Well, it's I guess more of the same, along the same strategic thinking. So if the insurance providers have a number of approaches and expertise in the environment of the whole set of services that are required to deliver health care, and Partners needed to develop that expertise and went to a local provider that it was well positioned and consistent with our mission, because the neighborhood health plan predominantly provides insurance to the underserved, and that works very well with our mission. Because if you can figure out how to take better care of inner city populations, then you're really going after the group that needs this help the most.
Many of the physicians here that will be watching this will understand this, but we have a whole bunch of people from outside the United States who come to VIVA, lots of industry people here. Tell us, what's the relationship between the Mass General Hospital and the Mass General Physicians Organization? Why are there two separate groups, and how do they interact?
You know, Mass General has a relatively unique situation. The tension between hospitals and physicians is ubiquitously present, and so it's always a problem. And a problem, but it can also be a strength of an organization. And our organization was specifically set up back in the early 90s to allow the physician voice and the hospital voice to be co-equal in the setting the trajectory of healthcare delivery. And it has worked amazingly well. We have incredible synergy between the vice presidents and the medical directors, the chief medical officers, the group of people who frequently have joint appointments in the two organizations, who are looking out for the best interests of both at the same time. It really helps to decrease the friction that frequently develops when you have a payment system that is in fact at odds. By paying one group separately than another group, you're creating the substrate for conflict, right? And fortunately, some very thoughtful leaders 25 years ago thought it should be done differently. And so we have a relatively unique organization.
And physicians who come to work at Mass General classically are part of the physicians organization?
That's correct. And everyone who is on staff who has an appointment at Mass General is a member of the physicians organization.
But it wasn't always like that.
It was not always like that.
Previously, you could be a private practitioner, use the hospital, and yet do your own business.
That's right.
So tell us what this term accountable care organization means, because it's thrown around like word salad in lots of places.
It is thrown around, and it's in, you know, again, sort of like population health management, it's a vogue term. Structurally, it's not something particularly new or different. People were talking and writing, economists were writing about these kinds of things in the early 70s. And it really is about finding ways within financial mechanisms, contracting mechanisms, to have the providers accountable in some way, in a reasonable way, for costs of care. The way that there are a few things that are different about this time than the managed care era in the mid 90s, which I lived through as an internist and don't have fond memories of. And a couple of things are different. One is this time we're not dealing with closed networks, so basically patients get to choose where they go, even if providers are taking risk. And a lot of physicians ask me about that and say, how is it rational for doctors to take risk on patient expenses when the patients aren't bound to use their services? They can use services anywhere. And it turns out that the answer to that is somewhat interesting, at least to me. And that is this well-known fact that a small percentage of patients are responsible for a large percentage of the costs. And those patients who are quite sick, and most doctors, for example, people who deal with vascular disease know who these patients are. Those patients tend to seek care at the same organization time after time because they know they're so complicated, it is not good for them to go to a different provider. So there's a natural inclination for the most expensive patients to seek care at a single place. That aligns well with this idea of an accountable care organization where physicians accept some risk. And in return for accepting some risk, if they do a good job of coordinating care and managing costs, then they will share in some of the upside, which means that it's not all financial penalties for physicians and hospitals, which is the alternative, right? I mean, if we didn't have this accountable care organization type structure, what's the other option?
Right.
If you're going to cut healthcare costs?
Right.
Well, you could just cut rates. And cutting rates seems to be an unproductive, it doesn't deal with the fundamental issues around payments in the healthcare system. It just leaves the same system in place, but just decimates it. I don't think too many observers of our system would think that's the solution to the healthcare, just cut the rates. I think we need to rethink, and we need to have incentives that change the game enough for it to be oriented more toward the benefit of patients.
So we have very limited time left. I want to get two things in. One, yes. You're doing a very cool thing that links Harvard Business Review to the New England Journal of Medicine. I think the audience would love to hear a little bit about this.
Well, I recommend going to the Insight Center website at Harvard Business Review. It's a joint New England Journal and Harvard Business Review website, which is posting innovations and articles about innovations in healthcare from business leaders, managers, and frontline innovators. It's a fun project, and I'm very pleased to have been asked to be on the editorial board.
You mentioned you have kids. How many kids?
I have 3 daughters.
How old?
17, 15, and 10.
Not keeping you busy at all.
Oh, they're wonderful.
Where do you like to travel if you could choose to travel?
I do enjoy skiing, and I haven't found a mountain range that I dislike.
All right, very good. Well, let me thank you, Tim, for traveling all the way from Boston to Las Vegas. It's great to have you here. We look forward to seeing you during the Business of Healthcare session this afternoon.
It is my pleasure. Thanks a lot,
Thank
Mike.
you.
Okay, take care.